unexplained weight loss, and oily stools.
And EPI symptoms can be confused with those of other common digestive conditions.
30 seconds.
Bowel syndrome,
thank you.
Crohn's, and celiac
All
disease.
right,
So
thank
getting to the
you.
right diagnosis meant being more open with
Pastor
my doctor about the
Vicky.
severity of my symptoms and how often they were happening.
But there's good news. EPI is manageable, so don't wait any longer. Use the symptom checker at identifyepi.com and schedule a visit or
10 seconds.
to ask, could I have EPI?
Sponsored by AbbVie.
Because facts matter. You are listening to WCPT 820.
We can change the world, change the world, change the world. We can change the world, we can change the world, change the world.
This is the Santita Jackson Show.
War and hate to a place of love, it's not too late. Gotta save the children, we can't wait. Let's change the world.
Hey, everybody. Welcome to the Santita Jackson Show. It's Wednesday, March 9th, 2022. It's a joy to be with you today. On WCPT, the nation's largest progressive talk radio station, took over the airwaves for Air America some years ago, and we're continuing to grow thanks to you. AM 950 Radio, the voice of progressive Minnesota. My family up there praying for the teachers as they strike. Our teachers are striking everywhere, and they are struggling, and they need our support. I'm Santita Jackson. I want you to call me at 773-763-9278, 773-763-WCPT. Let's talk about health equity, disparities. Oftentimes when African Americans, when Black people go to the doctor, if you look in their charts, there are a lot of negative descriptions of their situation. Got to talk about that. It happens to women too, but for Black people, it's amplified even more. And then we're going to talk about Blacks in Europe. Yeah, we've kind of touched upon that before, but many African Americans that I've gone to Europe, a lot of times I've even spent a good deal of time. I won't say that I lived there, but I've spent, weeks and months there at a time. And I will say this, there are parallels between what happens to Black people everywhere in the diaspora. And we need to talk about that because we saw this as South Asian, dark-skinned people, and African immigrants, dark-skinned people, were not allowed to get on the trains in Ukraine. Now, otherwise, they've had good experiences, but then there's been a mix of experiences, and we want to talk about that today as we seek to create a better world. So let's get to some of these headlines, everybody. There's a lot to talk about on the Santita Jackson Show. In Chicago, we're going to have a high of 41 degrees. It's spring in the air, everybody. Partly cloudy. Minneapolis, St. Paul, not there. 20 degrees above zero and snow showers. Tonight, in the NBA, we're going to have an active time. The Thunder will be playing the Timberwolves, and the Bulls will be facing off against the Pistons. And in the NHL, well, both the Chicago and Minneapolis teams were triumphant. Chicago 8, the Ducks 3, the Wild 5, and the Rangers 2. President Joe Biden announced a ban on Russian oil on natural gas and coal imports to the United States from Russia in a bid to further pressure Russia's economy at the risk of even higher gas prices at home. Call me. I want you to tell me if you're willing to pay higher gas prices to support the people of Ukraine or to support this military conflict. Call me at 773-763-9278, 773-763-9278. The UK and the EU both announced less immediate Russian oil and gas cutoffs. But now Russia is not going to have any McDonald's for the foreseeable future and no Starbucks. That's right. That is part of this boycott that we're having of Russia. What do you think about that, everybody? Call me at 773-763-9278. Are you willing to pay the price? Are you willing to pay the price? Poland has okayed fighter jets to Germany so that U.S. can give them to Ukraine. As Ukrainians on Tuesday battled a Russian invasion that has led to a refugee crisis of millions of people and a mounting civilian death toll, Poland announced a plan to send all of its MiG-29 jets to a U.S. air base in Germany so that the United States can transfer them to Ukraine. How do you think that's going to work out, everybody? Call me at 773-763-9278. The Senate has passed Postal Service Reform Act, a sweeping bipartisan bill that will overhaul the U.S. Postal Service's finances and allow the agency to modernize. By making changes to health care coverage within the agency, the bill is expected to save the Postal Service $50 billion. South Koreans are headed to the polls today to elect a new president, or they're heading there since there's a time difference. They want to know, we're going to see who is going to take over an evolving slate of challenges facing this powerful East Asian nation. Can't forget this, everybody. 250 plus groups rejected President Biden's attempt to rebrand President Trump's Medicare privatization ploy. What do you think about that? Call me at 773-763-9278, 773-763-WCPT. And there's a strike, as I said at the top of the show, in Minneapolis, St. Paul, for all of my AM 950 radio listeners. Education professionals in Minneapolis went on strike yesterday after failing to reach an agreement with the Minneapolis Public Schools. Backed by representatives from local and national teachers' unions, educators are calling for better wages for education support professionals, smaller class sizes, and increased school safety. Classes are canceled indefinitely for about 30,000 area students as the strike continues. Similar negotiations and strikes have played out across the country, including here in Chicago, as teachers and students face dwindling resources. Everybody nearby, St. Paul recently avoided a strike with a new agreement between teachers and the city's school system. We have got some good news from Pastor Vicki Johnson. My dear friend, it's so wonderful hearing your voice this morning. St. Thomas Lutheran Church at 80th and Jeffrey here in Chicago. When will you be resuming in-person worship?
We resumed in-person worship this past Sunday.
How did it go?
Effective March 1st. And it went quite well. People, not as many people came as we expected, but they were masked and very happy to be together worshiping in person.
Does make a difference, doesn't it? Does make a difference. Does make a difference. Well, what's the good news today?
All right. Well, good morning, Santita. Good morning to all of your morning stars and friends. There is good news. Today I want to talk from this theme, don't break before your breakthrough. Don't break before your breakthrough. One of the most difficult things for us to do is to wait. We've had to do it all of our lives, and we still don't like it. We waited for a dangling tooth to finally fall out of our mouths so that the tooth fairy could come. We waited from July to December for Christmas, creating a list along the way and checking it twice. And on December 24th, we could not wait to see what would be under the tree on Christmas Day. When people would ask us how old we were, we would say 12 and a half because we could not wait to become a teenager. And right now, CPS students can hardly wait for spring break to come. It's not just children. As adults, we can't wait either. We apply for credit and can't wait until it's approved, so we break and go to the quick cash store with ridiculous interest rates, and our breakthrough was right around the corner. We pray for healing in our minds, bodies, spirits, relationships, and the like. And as we get right on the brink of the breakthrough, we break because it doesn't happen fast enough. And you've only been in Lent for 1 week, this season of prayer, penitence, sacrifice as we prepare for the passion of Christ. And you feel like you might break already because you can't wait for it to end. They say that good things come to those who wait. Isaiah put it this way in the 40th chapter, but they that wait upon the Lord shall renew their strength. I know you get tired of waiting. I know it's not easy. I know you wish there was another way. So do I. If while you are waiting, you stay close to your God through prayer, reading the Word of God and other spiritual material, surround yourself with supportive and encouraging people. And I like this. And sing a simple song. It will strengthen you so that you will not break before your breakthrough. If you can do this, and I believe that you can, then to me, that's good news.
Amen to that. It seems that you always give up just before it's about to come through. Just before you're about to,
Just before.
just before it's darkest before the dawn. All of that. Oh,
Yes,
thank
yes.
you for that. Thank you for that. I needed that today, and I know that you did too. Got to give a special shout out to AB from London this morning. Hey, 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 sending much love. You know, I got a lot of Brixton love and a lot of love in London. I love that place. It's one of the few places, Pastor Vicky, where I do not get jet lag. I
All
always
right.
land, and whew, I, I hit the streets. I even take the subway over there. I love it. I just do.
Yes,
Sending
yes.
you much love and sending you much love again. Are people able? Will people be able to kind of like have a hybrid worship? Will they be able to follow you
Yes,
online?
yes,
And okay, so again, how can we do that?
yes. Because, we're in a new day now. We're in
Mm.
a new day and time. And so the things that we did during the pandemic, they're kind of spilling over into what is creating an atmosphere for more people to participate in that which we do. So yes, we will be in person at 11:45 a.m. and we will still be seen on Facebook Live at 11:45 a.m. on the St. Thomas Lutheran Church Chicago Facebook page.
All right, all right. I love that. I love it because it is a new day. The world we left is not the world that we're coming back into, everybody. So
That's
please,
right.
that's right. It's a different day. Make the adjustment, everybody. I am Santita Jackson. It's a joy to be with you. Always wonderful to have Pastor Vicky with us, and it's wonderful to have Dr. Deborah Fur Holden, brilliant epidemiologist, associate dean of public health at Michigan State University School of Medicine. She helps us to really unpack the world of health, and her focus is on equity. So we're kind of arcing in that direction. And of course, Shanina Knighton. It's at Hey, Dr. Nina. I love it. And she's a brilliant infection preventionist. She's a registered nurse, and she's a research scholar at Case Western Reserve University. Someone that we have been able to bring to you, thank you, Dr. Deborah Holden, so that we can understand just kind of sort of what we're looking at and how it is that we can prevent infection. And that's something that we're going to do past the pandemic, which we're still in, but they said the pandemic is endemic. So I guess no one really wants to talk about that anymore. And it's interesting. Dr. Holden, before we get into these other stories today, an analysis published yesterday warned that the Biden administration is likely to miss its modest goal, Common Dreams writes, of donating more than 1 billion coronavirus vaccine doses to the world by the end of September. Um, what does that mean? Does this mean that these doses are just going to go bad? I mean, what happens with them?
Well, what happens when you buy groceries and then you don't eat them in time?
Hmm.
They expire. And, we probably all had some milk in our cereal that was not quite as fresh. A few days past the date, we've all, we used to call it toasted bread. That bread that's been in the bread box for too long and don't quite taste good. But if you toast it, it's just fine. We can't do that with vaccines. You can't make toasted bread out of vaccines. And I wouldn't recommend our act of global stewardship to be to give expired vaccines to other countries. But that's where we are. And again, I think it's because there's a real lack of authentic global stewardship and a core value of really understanding and appreciating how it is it is the job of all of us to make sure that we take care of the least of us. And I don't mean least as in less valuable. I mean least as in less resource. So, yeah, you know how much vaccine we've wasted? And what's so crazy is the vaccine companies still get paid regardless. Our tax dollars paid to create what's in the vial. Our tax dollars paid a lot of the cost for getting those vaccines out to communities, for getting the shots in the arms of people, and we're also paying for it to go in the trash. It's really, just really unfortunate. This administration has not, in my opinion, delivered on anything substantially different when it comes to health and this pandemic response than the administration before them. And that's just my opinion.
Well, and the rich have gotten richer. The poor have gotten poorer.
Yep.
The sick have gotten sicker. And according to this study, 7,000 people each day around the world are dying from COVID. And I'm trying to figure out, we don't share the patents, which to me is cruel. And now we are sitting on top of medicine that they know Americans are not going to use, Dr. Deb. Americans are not even getting boosted. I mean, so I'm trying to find out what is supposed to happen. Will they start distributing those doses in to the American public?
The doses that are what?
That are getting old.
Well, you can't force it into people's arms. We already tried that.
No, I'm just asking if are they just going to sit there? Will they be destroyed, or will they be distributed, or is there something that will happen in between?
The ones that expire will just be discarded. We've made very, very little progress in increasing vaccination rates. Mostly the people who wanted the vaccine, especially at this point, have gotten it. Most of the people who have not gotten it, they're not sort of still in a wait and see pattern. They're just a no. You know, and now we've got this added problem of, and this is an issue that I'm facing and finding in my own circle, and I'm having to go all the way back around the barnyard, that people got the vaccine and haven't gotten their booster. And so we've got multiple problems that we need to solve when it comes to this. But I don't think there's the demand for vaccines in the U.S. has only gone down, not gone up. There was a point when we had a supply-demand problem. Now we've got it the reverse. We've got more supply than we have demand. So I do think it behooves us to figure out how to be better stewards of this resource and how to do a better job of getting it to places where it's needed the most across the globe. But that shouldn't be ours alone either. We should be at the forefront of helping to, coordinate a international movement for vaccine equity. That's the other thing, because not all the vaccines have the same issues that ours have. Not all the global vaccines require that they be stored at these ungodly low temperatures. Not all the vaccines have that. So there are other vaccines that are better candidate vaccines for lower income countries and countries with some issues that might prevent them from being able to manage, for example, our Pfizer or Moderna vaccine. And we should do that work. We should do that work with our global partners. This is the real time for the people who benefited, to stand up. And I don't know if y'all are going to talk about this on some other segment or on the show at some point, but these gas prices are disgusting to me. And I'm like, I would love for an economist to explain to me how, if most of our gas is produced right here and it's coming locally, why is it that gas is going up so much?
Well, we do have an economist on the show. We have an economist on the show every week.
They're broken down for me.
I know, and we can talk about that, because that's why we talk about Ukraine and we talk about international issues, because what is global is local and what is local is global. And we're going to be looking at all of that, because now they're tying inflation to what's happening in the Ukraine. And the fact is, we had a 40-year high of inflation way before this. So there are some systemic inequalities that we still refuse to deal with, and we want to push it off on these boogeymen and women who we have in our global communities. And that's a non-starter.
Exactly it.
I mean, it's a
The
non-starter.
global boogeyman.
Yeah. Yeah.
We've done the same thing in part, I feel like, with this vaccine and the vaccine distribution, and sort of pointed to all the reasons why we can't, I mean, think about it. Canada came right out the gate, purchased up all the vaccine that they needed to fully vaccinate 2 doses for everybody in their entire population. And we had parts of Africa where only 5 doses of vaccine had even been made available. I remember us talking about that. 5 doses for a whole country.
For a whole country. Look, and fortunately, some of these countries, because they have had anti-malarial drugs in their system and they take them regularly, you did keep, according to some studies, COVID-19 rates low. But the fact is, we've not been good stewards. We've put profits over people, and we're paying for that. And we are. So don't worry. We have Dr. Max Wolf on the show every week. He's an economist, and we talk about issues just like this every Thursday. So you just got to stay tuned in. We've been looking at health equity. I know that is really your bailiwick. That is something that really is at the center of your work. You want health equity, not just vaccine equity, but health equity, equal access to equal high quality health care wherever you are, no matter what your income. Health care has to be a right and not a privilege. Well, I came across a few stories, and I want to start with you, Dr. Deb, because when we get on the other side, this is Fierce Healthcare. They do a lot of wonderful studies, and they looked at this study and found that Black patients who received care at some urban academic medical centers were more than 2.5 times as likely as white patients to have negative descriptors listed in their electronic health record. That is to say what, Dr. Deborah Verholden? I've got 1 minute, literally.
You said they're can you just repeat your last statement one more time for me?
Sure. Black patients are 2.5 times as likely as white patients to have negative descriptors listed in their electronic health record. Now, some of your colleagues say that this is an indication of implicit racial bias, but it's very, very interesting. Aggressive, non-compliant, defensive. That's how they're described.
It goes even worse than that, because people point to implicit bias and they talk about it a lot. And there's, testing and training and a large implicit bias center that's been fueled by a lot of federal dollars. And I do think that work is important, but the missed opportunity is to deal with the explicit bias.
Mm-hmm.
There are a lot of people in healthcare and a lot of people that are decision makers, and a lot of high-paid physicians, division chiefs, department chairs that wear their, values right on their sleeve. We've got a couple of studies underway. One is looking at coding the conversations for the transplant teams.
Well, no, hold on. Hold that thought, because this impacts, literally, this can add or take years from your life, depending upon how you're perceived by your medical team. Are you aggressive? 100%. Are you non-compliant? If you're non-compliant, eventually you get ignored because you're just not worth the trouble, everybody. Are you defensive? Can your medical team, can your physician, can they get information to you, or do they think you just shut down, or do they just think that you're an angry Black person? We got a lot to talk about. Implicit and explicit bias. We want to talk about that on the Santita Jackson Show. And then coming up, we're going to talk about Blacks in Europe. What are the experiences that Black people have in Europe and South Asian, dark people? We, the people who are darker than blue. As Curtis Mayfield wrote so many, many years ago, Black patients wait longer for diagnosis and treatment of colorectal cancer. I mean, everything's adding up, everybody. And if we're going to change the world, these are the things that we have to change. Call me at 773-763-9278, 773-763-WCPT. AB, sending you much love. I'm a fan, too. I love London, and I love you. Back in just a minute.
This is Chicago's Progressive Talk, 820 AM.
Dr. Knighton, Dr. Shanina. Hey, Dr.
.com, where facts matter.
If you're like most Americans,
Is she there?
you're pretty much in disbelief with what's going on in the world.
Dr.
As
Nina?
we all know,
Dr.
global
Shanina.
problems are having
Oh,
local
okay.
consequences.
She's there.
Many of
I
them.
can't hear her.
If the
Okay,
peanut butter really
yeah.
hits the fan.
Matt, can you bring the radio down just a bit?
Yeah.
Okay, Dr. Deb, excuse me, Dr. Deb,
Yep.
Dr. Nina?
I'm here, and Dr. Knighton.
Okay, all right, just checking. You always have to
You wanna
check.
hear me? I said Dr. Deb just hit a talking about that gas. You about to get 1,000 callers about that gas. Cause
Well, you know, part of it is, look, we were having problems with inflation before this. And I think I'm always looking at mischief, because now they're passing in order to get many Americans, you know, we're all sympathetic with any country that's invaded. So, you know, we look at Ukraine and say, hey, we want to help because what's happening to you is awful. But we have also been asking questions about how we got here. And that's something that people say, oh my goodness, you're doing the Putin talking points. No, I'm not. No, I'm not. I want to know how we got here so we won't come back here again. How about that? Then we've asked questions about peace. Everybody's like, all we are saying is give peace a chance, which upsets the military industrial complex as they make money off of war, quite frankly. They do. And so now, even though America said that we're not going to involve our military, but we're going to use our military bases to be involved, that becomes a problem. Particularly when you look at China on the other side, because Russia shares borders with Europe on the east, on the west, and China on the east. They signed an agreement at the Olympics where they said they have a no limits partnership. What do you think that means, ladies?
So I'll be honest, I think this is all disgusting because, like, one of the things that I will tell you that opened my eyes up was that the bill, and I'm trying to think about what it was. It was like the COVID recovery bill. It was like part 2 last year, and that was the one that ended up getting people like $1,200 per pay, or it came out like, well, maybe they should get $2,000 or something, and it raised a big red flag because, long story short, Trump had rejected the budget, but what came out of that rejection was the fact that it was like $85 million in there that was going to Pakistan to support, like, let's say their transgender program. Then there was like maybe another $75 million that was going somewhere else. And so to me, what's upsetting is, as an American, I feel like sometimes my work and my efforts is being prostituted out to be able to pay for other countries. When here it is, it's still homeless people here. We can't get health care. We got $4 in gas prices, right? Or I got $4.09 where I am. LA was $6, like literally this past weekend.
And then what they're going to do, I promise you, Shanina, is tell you that this is all Putin. I'm like, look, we could be energy independent. Stop playing these games. If you want regime change, you're not being really democratic, because the solution, as a Democrat, lowercase d, as an American citizen, is not a coup. It's a new election. How about that?
It is.
So, so it's just like, it's just stop. And Erica, I hear you. You said so many complaints on Biden, but do you think a Republican in office will do better? No, they won't. I see a corporatist agenda with Democrats and Republicans, and I voted for President Biden, and I reserve the right to criticize him. I'm going to do it to make him better. I'm going to do that. I won't stop.
If we don't push back on this gas issue,
you better push back on everything.
Hold
on.
Change the world, change the world. We can change the world, we can change the world, change the world.
This is the Santita Jackson Show.
War and hate to a place of love, it's not too late. Gotta save the children, we can't wait. Let's change the world. I am breathing.
Hey, everybody. Welcome back to the Santita Jackson Show. Boy, oh boy, Dr. Deborah Verholden opening up a can of worms as we're talking about inequities, health inequities, health equity, and health inequities, as we look at how Black patients are treated, or how they are being described in their health records as aggressive and non-compliant and defensive. And all of these become reasons for for your medical team to push back on you, maybe not to treat you as well, not to treat you with as much care. There are so many things that emanate from that. And we want to talk about implicit and explicit bias as she talks about these gas prices, which will impact how we live. Many people are going to have to stop driving their cars. Many people, we are already in the midst of an inflationary boom that we have not seen in more than 4 decades. That happened before Ukraine, everybody, before. So, what is going on here? And what is going on when you go see the doctor? When you talk about some of the problems that we have here, um, in terms of whether we're going to get the shot, whether or not we're going to get the shot, people have not felt respected when they have gone to get their medical care. They haven't. They've not been treated well. And you can see it in their medical charts. And then we see this: Black patients wait longer for a diagnosis or treatment of colorectal cancer, which takes people out. I just buried a friend with that last week. So it's a lot. So call me or text me at 773 763 9278, 773 763 WCPT, 773 763 9278, 773 763 9278. And I want to take your questions, your thoughts about these rising gas prices, which people are saying. I heard them on the news this morning. Oh my goodness, now Americans are going to, basically, they're putting Americans in the fight. Really? Is that the way you want us to be in the fight? Call me at 773 763 9278. And what about these providers who use more negative descriptors or descriptions of their Black patients and health records? Let's deal with the implicit bias and let's deal with the explicit bias. First, you, Dr. Verholden, and then you, Dr. Shanita Knighton, because both of you have had to advocate for relatives and friends. And thank goodness we have people who are highly regarded in the system who can advocate for us. Everybody does not have that. And in fact, most of us do not. Dr. Verholden.
Yeah, it has a cost, right? And so without going into too much detail, I can say we've done the studies. We've looked at it. We've watched providers describe a Black patient as a drunk and a white patient as somebody who has an alcohol disorder or somebody who needs treatment. Think back to what we saw during Katrina, when people were, very similar to the situation in Ukraine, where people are out foraging and trying to find food and things like that. We look at them as survivalists, but we talked about, Black and brown people in New Orleans as looters and thieves. So there is a particular, lack of humanity in how we talk about and treat people, and will frame and contextualize the exact same experiences or behaviors for some group in a positive, resource need light, and others in a very negative failure of human character context. And we've got to deal with that, because that actually translates into the type of care people receive, the quality of care they receive, and sometimes whether or not they receive care at all. People are oftentimes refused treatment. We haven't talked much about the opioid epidemic, right? Everything got sort of trumped by COVID, but we saw our first decline in the opioid epidemic and rates of use and opioid overdose deaths following this declaration by the Department of Health and Human Services that opioids were a public health crisis and that the abuse of opioids were a public health crisis. The reductions that we saw in the year following that declaration and the rollout of all these resources was only experienced by whites. In fact, for Blacks and Hispanics during that same time period, we saw an increase in opioid overdose deaths. So how we talk about and how we frame these problems, it's literally costing people their lives and their longevity. People shouldn't die because of treatable health conditions, because the people who are delivering the care and providing the care, whether it be unbeknownst to themselves or it be explicit and on the table, are bringing their own values and their own biases to the decision-making process. But we know it's happening, and we got to do better with data and policy to disincentivize that type of biased care, and we can do it. The data do tell the story. Why is it that only X percent of Black patients are being referred for specialty services when 3 or 4 or 5 times that many of white patients are, or wealthy patients, or patients with private insurance. Because the bias and the ism isn't just anchored in race. It's anchored in race, gender and gender identity, socioeconomic status, which in the healthcare system, a good proxy for that is what type of insurance do you have? Most care providers prefer people where they can get the maximum billing and cost reimbursement for services that they're providing. If you have a high Medicaid population, Medicaid regulates all of the amounts that you can charge for service. So if you say, I'm charging $250 for an office visit, and Medicaid says we're only going to pay $100, you can only bill Medicaid for $100, and you, by law, are not allowed to bill the consumer for the difference. So if you have insurance, there's some protection in the cost that you pay, but providers have more skin in the game to take people who have the type of insurance where they can get higher reimbursement rates. There's a lot of stuff that has inequity baked in to our healthcare system. And the real question is, what's the work to get equity baked in? You know, your socioeconomic status shouldn't dictate the quality of care that you get, the type of insurance that you have, your skin color, but all of those things we know are primary drivers of the quality of care and the type of care that people get.
And your socioeconomic circumstance. Chris McGreal, who writes for The Guardian, we've had him on the show several times since 2019, which is when I started on this show, come June. And he found that in 3 pharmacies in a West Virginia town of fewer than 3,000 people, Dr. Deb and Dr. Knighton, they sent 30 million pills, 30 million pills, opioids, to a town of fewer than 3,000 people. These are poor white people, and they have been trashed too. And that's why the Sacklers have been sued. But the corporate structure is protecting them and their billions. And we've got to look at all of this. That's why you're here talking about health equity. But let's go to you, Dr. Shanita Knighton at Hey Dr. Nina, at Hey Dr. Nina. Go on and catch her on social media so you can find out what to do. I'm going to go to you, Mark, in a hot second. But why don't you respond to this? What about these negative descriptors? Aggressive, non-compliant, defensive. She's an angry Black woman. They're not compliant. They're too emotional. Because it happens to women too, whatever our colors are, whatever our color background. But it's amplified with Black people. The contempt is there. How does it play itself out in our healthcare?
So for a big deal, one of the things that I found interesting, and I can't wait for it to come out, but long story short, there was some data that was collected by quote-unquote sociologists back in the early 1900s, and it was describing neighborhoods, right? And apparently the majority of these documents were destroyed, but a lot of them were actually still not destroyed, let's say by accident. And what was perplexing to me, like, for example, in Northeast Ohio, was the fact that when the descriptors was written up for the government to come in and buy land, it might say this isn't a good neighborhood that's going to do a return on value because 4 Black families have moved in. They also made it seem as though, and so this kind of goes into the whole redlining thing, right? When you're thinking about resources and them outlining resources in regards to the nearest hospital, in regards to grocery stores, the different resources. We've seen this done in so many different aspects of life. And while people try to say that racism isn't a public health crisis or it does not exist, it is those historical documents that we have to go back to and look at them with an objective eye and say, was it necessary to note that it's 1 Black family, 3 Black families? We're not noting how many white families, right? It's just the Black families that are pointed out. So I look at that, and I then look at healthcare, and I think to myself, as we reflect upon the neighborhoods that individuals still live in, okay, and we say, okay, well, the money isn't spent here in order for there to be good upkeep of the environment itself, and we know environment plays a big deal into health. Then we also say to ourselves, okay, now insulin was prescribed for this new patient that just had diabetes, But yet we didn't even ask if he has a refrigerator or stable housing in order for him to be able to put it in. We assume that individuals have resources, and when they do not have resources, they are labeled non-compliant. They are labeled, oh, well, they're just being they're not being disciplined with their care, or, oh, they just don't care about their bodies. Oh, they just don't care about this. And I always say that if none of us have food, shelter, and water, it is very hard for us to even think about health if we don't have the basic needs of life met. And so when I look at situations of, again, I've been that nurse that is taking care of patients that live, like, let's say, in lower income, because that's where the hospitals are located at. And I've watched some of my colleagues come from rural areas, come from the suburbs, and they come into the facilities, and some of the times the way that they talk to patients have ended me up in situations of where I'm arguing with my colleagues. And this is even as a new nurse. And so if you can imagine then what happens, that means retaliations against my schedule. That means retaliations, you know, when it comes down to, let's say, workplace bullying, unfair assignments, things like this happen. And I'm sure that there is more than one healthcare provider, specifically even nurses, that can resonate with that, because it's like, wow, our job is to be advocates and protect, you know, patients that may experience, you know, the inequities with care, experience, you know, people talking down to them. It is a whole different perspective. And I've even had that even with my mother, who couldn't receive oxygen after she had been calling on the phone. And it took me to literally get on the phone, and I hate to say it, but curse out her provider in order for her provider to realize, like, I mean business. And if something happens to my mother, it's going to be on your license. It took for me to have to be aggressive in regards to her care in order for her to get oxygen. She had been looking for it for 3 months, and literally it took about a week in order for it to get there. And so it's sad that sometimes we have to behave like that, but it's a lot of times that people's messages fall on deaf ears, and especially when insurance doesn't match up. Santita, there are cancer patients right now that literally are sent home with a nurse, or no, they're sent home with like flushes, right, to flush like their port where their radiation treatments will go, but they don't have, their health care doesn't even allow a provider to come out and do it. So they'll send you the supplies, but it doesn't cover the provider. Or your provider is covered, but it doesn't cover the supplies. So it's a broken system in that the insurance companies as well as the providers are not matched up in a way to make sure that every patient is going to get what they need. What they need. So it's definitely a lot of inequity. It's a lot of racial barriers that also come into that. But just as you mentioned, for individuals that are poor and white that may be health illiterate or have health literacy issues, they're in the same boat in so many regards. But unfortunately, when we still look at the numbers, the chances of lives being saved, when we're talking about, or the disparities between lives being saved, unfortunately, Black and brown people are on the lower end of that spectrum.
And indigenous people are behind us. No one really tracks them. And when they track them, the numbers, the percentages are absolutely shocking. I want you to call me at 773-76 to the point. Call doctors for Holden and Knighton so that you can speak with them about health inequities. And after we take Mark's call, I want to ask what we should do. I mean, I don't want to have to turn myself into a pretzel when I go to the doctor. I want to be honest with them. I don't want to have to pervert myself in order to get along with my healthcare provider. But, we're going to talk about some remedies to this, or some of the things that we have to do. I just don't know what to do, because you can't legislate love or respect. Mark from the West Side. Mark, how you doing?
Good morning, Santita.
Good morning.
Thank you for taking my call.
Of course.
I have a question. I guess I would direct this to Dr. Knighton. But right now, there's this huge push to telehealth and kind of virtual health visits. And I'm thinking just from an equity standpoint, and just in terms of our own population, and kind of how we behind the 8 ball when it comes to technology. What can we do? If let's say this keeps growing, what can we do from a health equity standpoint around telehealth? Because that's it's the new it thing, and it's coming whether we want it or not.
I agree with that, and I think so much for your question, and it's actually a very good question because one of the issues that that we have is just the digital disparity, which means that, like, yes, a lot of these providers are going to this mode, but yet individuals don't even have the technology infrastructure set up or capabilities regarding their phones or regarding any technology that is within their homes. And so one of the things that I do encourage people to do, that if you are near a library, libraries provide free computer classes. They provide free Microsoft classes. They have these resources, like, just in itself. I understand that in some regards, it may not necessarily be the privacy factor that you may be looking for. But if it comes down to just being seen, even if it is virtually because you can't make it into a facility, that's better than none. And it's finding out what resources are around you just in case you do need to have that emergent situation. Now, of course, naturally, I'm not going to advise for someone to go in if they're having like cold symptoms. But if it's something else that's going on and you are able-bodied, then yes, I would say take advantage of those resources. I do see a lot of times that individuals are getting left behind, and the issue then comes is with telehealth. A lot of the times, let's say with the virtual visits, you may be seen, but without having, let's say, that ongoing relationship with that same provider, it then provides a barrier. So it's like they're up under a time crunch in regards to how much time they can even spend with you on telehealth before they got to move on to the next caller or to the next person that they're going to be seeing. So there are still these challenges that are within it. And I just tell people, that to see what's equitable for you, but do not skip out on care. Meaning that, yes, right now gas prices are ridiculous. And so we're not even going to talk about how that plays into this further situation of inequity, right? That somebody has to decide between whether or not they have enough gas to go see a provider, then have to get to the provider, and now they got to pay for parking, and then they got to drive back home, and then they got medications to get on top of that. But literally, because the gas prices is increasing, that's cutting into the little bit of extra money that they may have, or the fact that they was robbing Peter to pay Paul. And so I always say that when it comes down to navigating telehealth, I'm not telling you it's worse or better than in person, but it's just going to be a situation of be prepared to use it just in case you have to, and utilize the resources that are around you if you can. To be able to learn, because I do understand not everyone has a computer in their home, and not even people may not necessarily have a library that's around. So it may even be worthwhile finding out from community centers that are around if you can take advantage of those resources. So it's really just trying to understand, like, what resources do you have that are around you just in case you need those services.
Okay, thank you.
Did that help you, Mark?
Yes, I mean, I think so. We have to have a strategy around it.
And that really is the key, isn't it? We do need a strategy. I mean, of course, Joyce said, oh my God, my eyes have been opened. I will start looking at my medical chart and health records more closely. I mean, Dr. Deb, Dr. Knighton, wow. Might we be surprised if we see how we're described in our medical charts?
And that is the truth, because I'll be honest, I looked at mine and I'll never forget. I told them that I have a drink once or twice a month, and on my problems list it said alcohol. It didn't say alcoholic, but alcohol. And I made them remove that. Like, I did. I made them remove it. I called them and I said, y'all don't get this out my chart. And I said, and I need to see the documentation of what was put down. So that is a very accurate statement in regards to the stuff that is listed in there and the stuff that others are going to paint a picture of. And so you are empowered to be able to look at those documents and speak on them, and especially to be able to gain a perspective. Like, I even had a diagnosis in mine of anxiety. And I'm like, I'm trying to figure out, like, at what point, did I tell you something? Like, yes, stress does bring about symptoms, other things, but it's like maybe that wasn't necessarily what I was coming in here for. So you would be surprised, and it even happens to providers, especially when you don't tell them that you are in healthcare. You'd be surprised how they try to label you and how they try to treat you. And so when I know that we talk about these issues, Santita, and some people may say, oh, it doesn't exist. No, firsthand. Like, I know for sure that it exists.
I mean, because your medical team, Dr. Verholden, they are making assessments about your personality, right? I mean, they're assessing you all the time, and it shapes your healthcare. I mean, what are some of the strategies that you would recommend that we employ to just given this reality? Because this is not going to change overnight. What are some of the strategies that you think we need to employ? I have a couple minutes here, and we're going to give Dr. Knight another minute. But Dr. Verholden, what would you recommend that we do? Because I mean, you need to. If you can't advocate for yourself, or if you can't say, I don't feel well, and know the medicine you gave me, it didn't work. I still don't feel well. If I can't say that without being judged or condemned, what's the point? Dr.
Yeah,
Verholden?
I hear you, and I think we need to leverage the things that we already have in place.
Hmm.
So, hospitals and healthcare providers who receive any federal funds, which is almost every care facility in this country, is required every 3 years to do what's called a community health needs assessment. The CHNA, some people call it in China, the community health needs assessment. There's no requirement that they break down that data by race, by gender, by insurance status. It's supposed to get community input. It's supposed to get consumer input. We have some other federally mandated surveys. One is called the Consumer Assessment of Health Plans, or the CAP survey. There's one specifically that's focused on older adults called the Health of Seniors survey. If we say that equity matters, we need to bring an equity-centered approach to how these federally mandated studies that hospitals, healthcare providers, and insurance companies are provided to do, so that we can actually first confront the what so. We need to first just get the what so. So getting this equity-centered approach baked in to these mandatory assessments and these mandatory requirements that healthcare and insurance providers have to do, I think would be a great first step. At least then they can't say we didn't know. See, I don't get into arguments with people about whether or not health disparities are real, because that to me is like arguing that 1 + 1 is 2. It's just certain things that are a fact. But a lot of people have been able to, and a lot of providers have been able to keep their heads in the sand by just simply not looking at the data that they have. And I don't think people will do it because it's the right thing to do. They've got to have their hands for it. That's my movement to mandate equity. And I do think that data is going to be an important part of that. Not because the data is going to drive the change, but the data will at least get us all in the same 1 + 1 = 2 conversation. It'll at least be inescapable that you've got these big differences. And what people will likely do is they'll point to the individual level determinants of health as the drivers for those things.
Mm-hmm.
And we can then address that as well. But we've got to start somewhere. And I think a bold reckoning with just the extent, right, of the existing health disparities would be a great place to start.
Well, my baseline health has nothing to do with me having to wait longer for a diagnosis if I've got and treatment if I've got colorectal cancer. So they need to cut that out. And these are the conversations that we need to have, because you're going to go to the doctor. You're going to go to the doctor, and you're going to see the healthcare providers, and you are going to be assessed. Blacks in Europe. Let's talk about that, everybody. Yeah, there are Afro-Europeans. You've got Afro-Americans, African Americans, and you have got African Europeans. And they have a tough time too. We were in Sweden just several years ago, and we went over there for the Almagellan, festival, where Reverend Jackson spoke with Bob Geldof, and he spoke, and then Bob Dylan sang. It was something really tremendous. But part of the trip was also to meet a young man who's now in the Swedish parliament, because he'd been threatened with a noose outside of his school. So let's talk about that, everybody. Back with more of the Santita Jackson Show in just a minute. Doctors Verholden and Knighton, Do you like these health equity stories that I've been finding?
So I do. I think one of the topics too that probably deserves, I would say, further exploration would probably be the discussion around like precision health or
Okay.
precision medicine, which is like a different model that's growing. And it is hard to like, let's say, look up a precision health provider, but I think that it'd be helpful if, let's say, you like me as a patient, I'm going into
I'm sorry, that was
a
me.
provider. I say, you know what are your thoughts, or like how do you feel about precision health? And that right there, like just in itself, if they can't define that for me, then I can't do business with them. Meaning like I can't give them I don't want to be cared for by them. Meaning like I do want somebody that's not only just looking at what they see physically, I need them to look at my genes, my behaviors, my exercise, my eating habits, my environment. I need them to look at everything that affects my health. And so we do see like snippets of this in the science, and it is a growing area because it does not only just focus on like the illness part of it or like the disease, us managing disease, but then how do we get into that public health space, that Dr. Deb is in, where we start talking about disease prevention and health promotion. And so I think that this is a bigger deal because people have to start evaluating where they are, where their family history is, and where they want to be, and really truly look at themselves and explore, are you going to be okay if this happens based off of how you're doing and where you're going? And so I've seen that happen. Like even my sister who has cancer, love her to pieces, but her doctor told her, I kid you not, 10 or 11 years ago. So her doctor was somebody that believed in precision medicine, okay? And told her years ago, like, these are the lifestyle habits that you're going to have to change and the things that you're going to have to adjust, or this could be an issue for you years down the line. So he actually let her know what she was going to be up against if she did not change her lifestyle habits and change some of the things that she was doing based off of her family history, as well as based off of like her current lifestyle habits. And so I think that we have to start thinking about health from that aspect, opposed to just saying like, oh, I need a doctor to fix me right now. We need to figure out like what's going to happen overall.
But I think that we need to know that we need to think that way because you're in the space. You and Dr. Deborah in the space. You know that this is that medicine has already gone down the street. Most of us don't know that. Precision
It
health,
is,
huh? It's
but
like concierge medicine. I mean, there's just so much that is out here that is at the next level. It's just like even having blue chip insurance. What does that mean? It means you pay a lot, but you get a whole lot of benefits.
and I got you, but since I would tell you this, right? So we all have experienced death at some point, in our lives, a loved one, okay? And whereas we come together, like let's family to be able to celebrate that life, that's also the time to be the nosiest,
Absolutely.
right? Like I lost my loved one, but like what happened? Like was this something that was preventable? Was it a lifestyle habit? And I know what that's like because even like let's say my grandmother, both of my grandmothers, I can't tell if seriously if they died just from like let's say Alzheimer's alone or was it alcohol induced,
Absolutely.
right?
Okay, we
Oh,
have Attorney Hoffler, Attorney Meyer, and Reverend Watkins ready.
About like what's happening, even if we're not in the medical profession, just really being nosy to understand how that fits into our lives.
you better find out. I mean, I saw that firsthand when my grandfather died when I was 15. My father said, now is the time, because he was the first major death we'd had in our family. He said, now is the time you need to make sure you have your burial insurance. Now we need to look at dad's health, what got him here, what got him to this heart attack that killed him. All of these things, that, but you're right. That's the time at the family service while you're looking, trying to find out if you're in the will, if there's extra family members and all these things. You need to find out about your genetics too, all of that stuff and what happened. How did we get here? How did we all get here today? Stay right there. I have got Attorney C.K. Hoffler. Attorney C.K. Hoffler.
Actually, she just dropped. I'm going to reestablish connection, but we do have Reverend Watkins and Attorney Myra.
Attorney Myra, how are you?
Try it again.
Attorney Myra?
Yeah.
Hi, Santita Jackson. How are you?
I'm very fine. How are you this morning?
Thank you so much for being with us today. And we're joined by Reverend Frank Watkins. He's really the communications director emeritus of the Rainbow Push and of Operation Push. And he and Reverend Jesse Jackson have been working together for more than 50 years. He's been his communications director.
Okay, Attorney Hoffler is back, and we have just under a minute.
Okay, thank you. Thank you so much, Matt. Great, Matt. Thank you. Attorney Hoffler?
Good morning, Santita. How are you?
Great. Why don't we start with Ukraine, and then let's arc into voting rights, okay?
Okay, is Jeannie Mira on?
Yes, she is. Is it Mira or Myra? Please help me. Myra. Okay. All right.
I'm sorry.
No. I just want to get it correct.
30 seconds.
Let's stand by. And I will let you do these introductions, CK, but let me get through these headlines first, okay? But we'll start with Ukraine, and then we'll move into, and I'll walk you into that. And we need to move into voting rights. If we're going to, double V, if we're going to fight for victory over there, we need to fight for our rights over here. So that's.
Okay. And everybody else is on. Gerald is on. Gerald is on.
No. We only have. We have Reverend Frank Watkins. Hold on.
Change the world. We can change the world. We can change the world.
This is the Santita Jackson Show.
War and hate to a place of love. It's not too late. Gotta save the children. We can't wait. Let's change the world.
Hi, everybody. Welcome to the Santita Jackson Show. It's Wednesday, March 9th, 2022. I'm Santita Jackson, coming to you from the nation's largest progressive talk radio station, WCPT, based here in Chicago. Indeed, we are formally Air America, but we're still Air America, but we're Chicago's progressive talk. This is really the capital talk for the United States. And then AM 950 radio up in Minneapolis, St. Paul, the voice of progressive Minnesota, sending much love to the public school teachers in Minneapolis who are on strike today. More about that in a hot second, as they fight for better wages and more resources for the children and for these teachers and the support staff who really don't get paid nearly enough. Think about it. What can you do if you don't know how to read? And where do you learn how to read? In school. Shout out to the Minneapolis public school system and the teachers and all of the children in it and all the parents, everybody who's impacted by this strike today. Let's work it out, everybody. I'm Santita Jackson. It's a joy to be with you today. We're going to be talking about blacks in Europe. That became an issue when we saw Black and South Asians blocked from getting out of Ukraine. That's been resolved, but it's still uncovered something that's uncomfortable for Europeans to talk about, and that is racism, the racist experience that Afro-Europeans, African Europeans, like African Americans experience while they are there. And so let's talk about that. I don't care how many generations they've been there. They experience it. You ask the blacks in France, you ask them in England, you ask them all over. It's the same story everywhere. So we're going to be talking about that. And as we fight for victory in Ukraine, we need to be fighting for victory in the United States, our voting rights. You still do not have a federally protected right to vote. I thought about you, Jose, yesterday. Thought about you. I couldn't get you off my mind after we got off the air. You wanted to know explicitly, where is the right to vote? You said, we have it. I said, no, we don't. We don't have an explicit federally protected right to vote. There's no one who knows more about this than former Congressman Jesse Jackson Jr. and, of course, Reverend Frank Watkins, who's with us today. The anniversary edition of their book, A More Perfect Union, Advancing New American Rights, which explores and really tackles this topic. We're going to be talking with him about that in just a couple of minutes. Everybody, in Chicago, we're going to have a high of 41 degrees, partly cloudy. Minneapolis, St. Paul, 20 degrees, snow showers. And tonight's going to be an active night in the NBA for Minneapolis and Chicago. The Thunder will be meeting the Timberwolves, and the Bulls will be playing against the Pistons. In the NHL, Chicago and Minneapolis were triumphant last night. Chicago 8, the Ducks 3, the Wild 5, and the Rangers too. Go, go, go. President Joe Biden announced a ban on Russian oil, natural gas, coal imports to the United States in a bid to further pressure Russia's economy at the risk of even higher gas prices at home. And since 1990, there are no open McDonald's in Russia. There are no open Starbucks in Russia. Risky oil and gas sanctions were once non-starters when it came to punishing Russia for its invasion of Ukraine, but something has changed. We'll be talking about that more throughout the week on the Santita Jackson Show. Poland has okayed fighter jets to go to Germany so that the U.S. can give them to Ukraine. How will that all work out? The Senate has passed the Postal Service Reform Act, a sweeping bipartisan bill that will overhaul the U.S. Postal Service's finances and allow the agency to modernize by making changes to health care coverage within the agency. The bill is expected to save the Postal Service $50 billion over the next decade. According to this headline from Common Dreams, you can't fool us. 250 plus groups have rejected President Biden's attempt to rebrand President Trump's Medicare privatization ploy. Everybody wants to privatize Medicare. Why? The money. Everybody, let's send a lot of healing energy to Minneapolis, because the education professionals in Minneapolis went on strike yesterday after failing to reach an agreement with the Minneapolis Public Schools. Backed by representatives from local and national teachers' unions, educators are calling for better wages for education support professionals. Sounds like Chicago, huh? And all over the country. They're asking for smaller class sizes and increased school safety. Classes are canceled indefinitely for about 30,000 area students as the strike continues. Similar negotiations and strikes, of course, have played out across the country, in Chicago and everywhere, as teachers and students face dwindling resources. Neighboring St. Paul, Minnesota, recently avoided a strike with a new agreement between teachers and the city's school system, sending them much love today. Everyone, you know we're on a campaign to try and save your homes. We want you to save your homes. We want you to know that you can get a home. If you don't have credit right now, if your credit is broken, if you have high credit card debt, if you need to build your credit or rebuild it, call Team Hochberg so that you can get the help that you need so that you can buy a home or save your home. If you need to purchase a new home, if you want to refinance your existing home, if you want to secure a VA loan or a reverse mortgage, call Team Hochberg. They're your trusted local lender. Steve, 70 years of age, owed the IRS $100,000 in back taxes. It could happen to anyone, and he was concerned he'd lose his condo. He contacted his CPA's banker and tax attorney's mortgage professional to refinance. They couldn't do it. And so they suggested that he sell his condo to sell off his debt. He's 70 years old. Where would he go? Well, guess what? He called Team Hochberg, and they worked it all out for him. They used his retirement assets to refinance his condo and pay off his IRS tax lien. So call Team Hochberg. They can help you. No problem is too great. First call is free. If you lay out what your issues are, I promise you they'll help you. Call them at 855-56-DAVID, 855-56-DAVID, or go to 56david.com. That number again is 855-56-DAVID or 56david.com. No problem. Too great to help you hold on to your home or to help you buy a home. Think about it. You've got these 2 and 3 flats in our neighborhoods. They shouldn't be neighborhood blights. They should be neighborhood lights. Call Team Hochberg at 855-56-DAVID or 56david.com so that you can get in the mix. Everybody, it's Legal Q&A with CK. So exciting to be able to talk to you. We're going to divide this up today. We've got 2 topics to talk about. Really, they kind of flow into each other. Of course, we were all dismayed over the past more than a week when we saw Black and South Asian students, dark people, blocked from leaving Ukraine. Of course, everybody's trying to get away from a war that was beginning. And so that stirred up a discussion about the challenges that befall Blacks who are in Europe. You know, you have African Americans, you have African Europeans, and they've been there for generations. Not just in the 17th century, they've been there for centuries. We're going to talk about the issues that they have. Indeed, C.K. Hoffler was in boarding school there as a child. So she has a unique view. I can't wait to hear her thoughts and to talk about this 2018 report. And it's not new, but I wanted to go back in some of these reports that talked about the racism against Black people in the European Union, widespread, entrenched. We were in Sweden some years ago, helping a young man who's now a member of the Swedish Member of Parliament because he was threatened with a noose because he spoke out against discrimination in Sweden, and on and on and on and on it goes. Being Black in the EU, according to this headline, often means racism, poor housing, and poor jobs. We have seen the Richard Wrights, we've seen the James Baldwins and the Maya Angelou's, and all of these most brilliant of Black artists. We've seen Miles Davis, we've seen Duke Ellington, we've seen Quincy Jones, we've seen so many brilliant artists, Jesse Norman. It goes on and on and on. You do have a freedom. I'm an artist. You do have a freedom in Europe, and you are celebrated there. But these are the best of the best. So who doesn't love the best of the best? What about the average working person? What about that? And as we're fighting for democracy and freedom in Ukraine, what about democracy and freedom in the United States? It sounds like, feels, CK, like I'm talking about my granddaddy, Charlie Henry. I've been talking about him a lot lately because he was a veteran of the Second World War, and he talked about the discrimination that sent him there and the discrimination that he had to face once he got back to the United States. But Black soldiers of that era, male and female, said we have a double V campaign, victory abroad and victory at home. We're fighting for victory. We're fighting for democracy. And this is an anti-fascist campaign overseas. But we're fighting the same issues in the United States. So we're going to be talking about the vote and why we've got to push for our voting rights. And the fact is, Frank Watkins is going to lay out for us that you do not have an explicit federally protected right to vote. You don't have it. You don't have it. And what does that mean? C.K. Hoffler, let's start with Black people in Europe. Were you surprised by these images that were very disturbing? It was Black and South Asian students who are dark-skinned people. They were blocked from getting on the bus, and then more of them started talking about their stories, and of course they were kind of blocked from Facebook. But were you surprised by these stories?
Sadly, Santita. First of all, good morning, Santita. Good morning to our panel and to our audience. Sadly, Santita, I was not surprised. As you accurately stated, my history with Europe and being an African American in Europe dates back to 1967 and 1968. When I was a student in school in Switzerland, and I lived there for a total of 10 years. I went back to university and did my junior year at University of Geneva. And there was much progress between 1967 and 1982. And I'm sure there's been a lot of progress when I was a college student. And I'm sure there was a lot of progress between 1982 and today. But when I tell you that I wasn't surprised and it struck a chord with me, it's because I understood and have been where those students are. In 1968, I was called a monkey because we have to remember that in the 40s, Hitler had people believing that Black people had kids, that we were like monkeys. And between Hitler's admonishment of Black people and his other disgust that there were Black people participating in the Olympics to 1967 and 1968 when I was in Switzerland, there was not a lot of exposure to Black people in certain countries. So when people don't have exposure, when people don't see, if they see on television. There are certain things that are in their mind that are unchanged until they have a different experience or until their movements that take place. So when I heard what was happening amidst a war, and in my humble impression, why don't we just say amidst what could be a nuclear war pretty soon, which we pray it won't be, that even under those dire circumstances, there are Black students that are being treated differently in terms of their ability to leave the Ukraine, that are being discriminated against specifically in terms of their ability to leave, to board buses, to cross borders. It sadly did not surprise me because the ravages of racism, of colonialism that had existed and permeated the European continent, and part of, all those countries are in part Europe, part Asia, still exist. There are generations where that has never been eliminated completely, much like it's not been eliminated here. It's just devastating, however, to see that happen, because at the end of the day, just as I'm devastated that we have to even go through protest again when George Floyd, Breonna Taylor, and thousands of other African American men in particular and women are killed because of excessive police use of force or police brutality and breaking the law by law enforcement. It's the same thing that I feel when it comes to Europe, because I live there. I live that experience. It didn't surprise me, for instance, that in London, Santita, when Black Lives Matter first took hold in Europe, and it sort of centered around George, even though there were people who were supporters and stood in solidarity before George Floyd's murder, heinous murder. When George Floyd was murdered, the world came to a different realization and a standstill on certain issues of social justice in terms of what was coming over here, what was happening here in the U.S. And in London, it didn't surprise me that people were being beaten, were being arrested by merely articulating, they didn't even get to the point of protesting, articulating and talking about the solidarity with the Black Lives Matter movement in the U.S. So all of this, for me, informs the treatment that these unfortunate Black students who are of African descent, just like we're of African descent, receive in this terrible, terrible war that's happening in the Ukraine. It's sad, it's tragic. The United Nations and other agencies have taken a position on it, are addressing it. Maybe there are small victories where people are, because of international outrage, are allowed to cross over the border. But trust me, Santita, I'm sure that there are statistics that reflect that there are thousands of Black students, of Black people who are not able to leave the Ukraine. And this has been going on for a while. And that's why, Santita, I wanted to have as one of our great panelists today, Jeannie Meyer, because not only is she a great voting rights, human rights, international lawyer who's been in the trenches out of New York for decades. I've worked with her. Remember, Santita, the voting rights case that we had Jill Briggs was involved with. I was involved with Maria Banjo on behalf of close to 200,000, we believe, disenfranchised voters in Georgia. This is prior to the Senate runoff election. We were co-counsel, and indeed, she led a very significant part of that voting rights effort. So I've been with her in the trenches, and if you're in the trenches, this is the kind of lawyer that you want. She's one of the leaders, and she's very involved with the International Association of Democratic Lawyers. She has testified, been involved with many actions at the UN that have stood in solidarity with those people who have been killed here in the United States at the hands of police brutality. She has taken positions publicly on the need for policing reform, and is a lawyer who has a voice in the international space on these issues. Indeed, the International Association of Democratic Lawyers, for which she's a part among the leaders, has released statements, and one particularly poignant statement, on the escalating war in the Ukraine and finding a road to peace, and talked about these disparities that we discussed. And so that's why I wanted this lawyer to be on our show this morning, Santita, to talk about this, because she's right there on the front line from a legal standpoint in addressing these international questions.
Amen. I mean, because these international, what's local is global, what's global is local. And so we welcome you, Attorney Myra, to the show and honor your work, because we are fighting a war overseas, but we're still fighting a war. I mean, and not just in Ukraine. Black people, South Asian people have a hard time sometimes. They face systemic racism and poverty and such when they are in Europe. And of course, we're going to bring up Reverend Frank Watkins on the other side of the break to talk to us about our voting rights, the fight that we still have here, CK, that in which you and Attorney Myra are involved. Attorney Myra, can you help us with what we have been seeing, and with more? We're hearing more about the experiences of Black people and dark people in Europe. Can you talk to us about that?
Well, sure. And thank you, CK and Santita, for letting me have the chance to talk to you today. we of course know that there's a long history of racism in throughout the world, and in particular U.S. and its manifestations in in Europe. If you think back to an interesting fact that when the war in Syria was raging and thousands of and millions of Syrians were trying to flee the war zone, what did Hungary do? They put up fences because they didn't want people who were not considered white coming into their country. But in fact, they've now turned around and opened up their doors to people fleeing Ukraine, and I find it sometimes it's difficult for me to get. So, I mean, of course, we're opposed to the Russian military actions in Ukraine, but I find that the valorization of the Ukrainian people, which is certainly justified, is being more raised up in the media, in part because the majority of the people in Ukraine are white, or are perceived as white, and that bothers me. You know, that the U.S. invaded Iraq and Afghanistan and
Yemen,
engaged in a number of Yemen and many other. There's bombing in Somalia. There's at the same time as we have to be careful not to fall into the trap of thinking that this war and these actions, which of course are violating the UN Charter's rules against military invasions, and is not in self-defense. We have to be careful not to consider either of these attacks being totally unprovoked or totally that Putin and the Russians are the devils, when in fact there's a double standard going on. And when it's people of Middle Eastern descent or African descent or darker skinned people who are being hurt, we don't have the kind of outrage, and that bothers me a lot.
But
IADL a lot.
But Attorney Meyer, it's like that conversation. We try to quell that because I've been told. Now you sound, Putin would be very happy with what you're saying right now. I'm like, don't play with me. Do not play with me. Don't play with me. Because I'm not playing that. Russian talking points, I don't know what they are. Clearly you do. So maybe you're an agent. I don't know. I don't care. I do know.
I'm not an agent.
I'm not an agent, but I think it's unfair to be accused of that, because I'm engaging in loving critique and examining an issue that is real. We were in Sweden a few years ago, and this young man had been threatened with a noose.
I can tell you that black judges in France are under attack. I can tell you that I've seen situations where black people throughout the world have, it's when you see COVID has had such an impact. And the lack of medical resources within Africa compared to the European Union. I'm not talking about. Well, let me make it clear. I believe that the racism in the EU is evident, and it was evident when you saw the fact that when people tried to flee, Black people, South Asian people were not able to be welcomed the same way as others from Ukraine.
Well, stay right there. White. I want you to. We're going to speak to that on the other side, and indeed, on the BBC, the Ukraine's former deputy general prosecutor, said it's been very emotional for me because I see European people with blue eyes and blonde hair being killed. See, he said, and then the presenter replied, "I understand and of course respect that emotion." What? Keep bringing it up because we need to talk about it, everybody. That's real. This is real. This is real. And as we're fighting for victory over there, we still need to fight for victory over here. We need our votes. We need our voting rights. All these fights are on the table at the same time. I'm talking with Attorney Jean Meyer international lawyer who deals with these issues of the diaspora. And of course, attorney C.K. Hoffler. Of course, this is our segment, Legal Q&A with C.K. And as one of our special guests, we have Reverend Frank Watkins, who can tell you that you do not have a federally protected right to vote. Ouch. Not in the United States. Back in just a minute. Oh, Dave, I'm blinking my eyes. I don't have my glasses on. So I'm not about to fall out on you. I just have to see. So thank you all for being here. This is great.
Attorney Hoffler?
Yes.
Are you on speaker by any chance?
No. No. I'm in a different city.
Copy that.
But I'm on the same headset. I'm in a hotel.
Maybe the headset's the issue.
Well, it's the same one I use. Not the headset, it's the earbud. It's the same one that this is what I always use.
Yeah, but
what I'm going to do,
I think they sound very different today. They sound different.
I think it's because I'm at the Aloft Hotel, and you know how they have, it seems like they have these, they're built for war duty. So I'm going to go downstairs where I'm outside into a room.
Wherever you are right now is great.
I'm in the hotel room in the
No, I'm just saying no, where you just moved? Did you just move?
No.
Okay, something, because it sounded like you were in a can. That's what I said.
Okay. Wow.
We're just trying to get the best sound quality so people can hear everything that you're saying.
Right. No, I for me, sometimes I'm in a hotel because I get this comment, not all a lot, but just I've gotten a couple times. It's just different where I'm positioned in the hotel.
Okay, well, let's see. I don't want you to put the phone on your ear, but let me hear. Can we hear it without the earbuds?
Hold on. Is that better?
Keep speaking, please.
Okay. I'm just checking to see if that's better.
Matt, how does that sound to you?
Yeah, that sounds really good.
Okay. Yeah, that's it. The earbuds, it depends upon where you are. The earbuds work, they don't work. They work better. They work better in some places than in others. But on this, with radio or with TV, you want as few generations or degenerations as you can. So, okay. So thank you, CK. Oh, boy. And Attorney Myra, thank you. Frank Watkins, you there?
Yes, ma'am.
All righty, dighty. Attorney Myra, do you all know each other, Frank Watkins, Attorney Myra?
No, I don't know her.
I know of him.
Okay. Oh, that's right. We're so excited. Well, we're going to, arc right into the work that you do here in the United States, too. The voting rights. He and former Congressman Jesse Jackson Jr. Have their, I guess, it's at the 20th anniversary edition officially of the book, A More Perfect Union, Advancing New American Rights.
Yep.
Mm-hmm.
Absolutely.
And they do a deep dive into this particular issue. So everybody, I want you to call me at 773-763-9278, 773-763-9278. Noel, Mama D, everybody else, I will be getting back to you, but we are going to go to these callers. CK, you can see we've got these callers. People want to talk about all of this.
30 seconds, and I'm going to very shortly here.
Oh, okay. Well, yes, get her up so I can let me know. Just give me a verbal so I can bring her up as soon as I possibly can.
Copy that. Okay, we've got 10 seconds.
Okay. Bring her up as soon as possible. So I'd like to come out of the break to her. Whew.
We can change the world, change the world, change the world. We can can change the world. We can change the world. Change the world.
This is the Santita Jackson Show.
War and hate to a place of love. It's not too late. Gotta save the children. We can't wait. Let's change the world. I am breathing.
Hey, everybody, welcome back to the Santita Jackson Show. We are talking about blacks in Europe and blacks in the diaspora. Oh, legal Q&A with CK. CK, you brought us a whopper today. We're balancing double V. Wow, it's going back like to the Second World War for real for us. You know, the victory at home and the victory abroad. The victory at home and the victory abroad. Black soldiers said, okay, we will go to the Second World War, but we need victory. Yes, over Hitler and over the Japanese, we need that victory. But we need a victory in the United States too. We need our voting rights. We need to not be lynched, killed by the police. We need all of that. And it seems that while we have made tremendous advances, these struggles are still here, CK, and we're hearing Attorney Myra walk us through
Mrs.
that.
Wells is ready.
And cannot wait to hear from Frank Watkins so he can explain to you, Jose, that no, you do not have an explicit federally protected right to vote. I want him to explain that. But let me go to you, Chaparral, very quickly. Celebrations by us. Oh, it's springtime almost. What am I going to order from you? I still want my dressing, but that's okay.
Good morning, Santita, and thank you so much for taking our call today. We are gearing up for prom as well as graduation season, Santita. So we have your sweet tables, your hors d'oeuvre party, appetizers, your sliders, your wings, your potato salad, your tuna salad, your fruit trays, and your sandwich trays. So don't hesitate to give us a call at 708-526-4546. 708-526-4546. We also do balloon arches, sweet tables, anything that you need to get your prom send off or your graduation party started. We are here for you. So don't hesitate to give us a call, 708-526-4546. Thank you so much, Santita.
Celebrations by us, 708-526-4546. Of course, that's Chaparral Wells. Attorney C.K. Hoffler, before we go to Frank Watkins, Attorney Myra, I don't want to cut her off, C.K. It's like she's going through black judges in France, having a hard time. It's like, oh, C.K.
I'd love her to talk about that some more. I'd love her to share with the audience because that is fascinating, and I know that to be the case too. But Jeannie, would you mind sharing with us your experience and the what is happening in France with black judges?
Yeah, the IADL has taken up the issue of a judge in northern France who was accused of a black judge who's over the years has been accused of various things that he's not guilty of, and we have been trying to fight to preserve his position on the court as a magistrate judge. I think you might know that over in France, the magistrates have a different role with respect to the legal system there, but that's been an issue that the International Association of Democratic Lawyers and our French Association has been fighting for. And this particular judge, I met him in South Africa in 1994 when we were observing the South African election, and we've maintained a connection with him over the years. His name is Jean-Pierre Augean. And that's one of the cases that we've worked on. But in fact, the IADL also does have an office in Lesbos in Greece, where we set up an office to help refugees from other wars, in particular that affect the Mediterranean and mainly Syria. But a lot of those refugees started going through France, and when they were burned out of camps up in Calais because of there was a lot of racism there. So these are some cases that we've actually been taking up and working on. We've worked closely with our Ukrainian democratic lawyers who are trying very hard to stay and fight, but also are very concerned about what's happening on the ground with the people who are fleeing the war zone and the unequal treatment of people of color and other Ukrainians who are not people of color. But these are we did a webinar that is I think is on this issue, which had our people from Ukraine talking about the situation. It was held on February 28th, and it's on the website of the Lawyers Guild at the moment, and probably will be put on the website of the IADL shortly. I don't know if that answers your questions, but I could go on and on with the instances that we are involved in throughout the world.
Well, CK, if I could jump in here, why is it important for us to even? I'll ask you and CK before we go to Reverend Watkins. I mean, why is it important for us to know about the struggles of African Americans? I mean, of African Europeans and Black people all around the world. CK and I, fully disclosed, we were in France this summer, CK, when Reverend Jackson got the highest award that is granted by the French government, the Legion of Honor. And it was exciting. President Macron gave us just really opened France to us, and we're so grateful to him. And we were very clear, and he was very clear, that France is in the midst of an awakening. And his admiration for Reverend Jackson, as CK, you can tell, he actually, the ceremony was delayed by an hour because he wanted to talk to Reverend, right? And everyone was shocked. They said he never does this. CK?
Well, and what was most extraordinary and magnificent about that experience with Reverend Jackson and Santita, so wonderful to share that with you and your family, was that he knew and understood and articulated the history of African Americans in France, starting in the early 1900s. And he took us through the history. And he also took us through some of the difficult times that France has had, with race relations. And so it is important for us to understand that. It's a similar struggle that we fight here. Mm-hmm. I can talk to any number of African American judges in this country, and some of them experience similar treatment as those French judges experience, French judges of African descent in France. So I think that to answer your question, essentially, why is it important? Because we have to stand in solidarity. A way of bringing about change and fighting against racism is by gaining and galvanizing international attention. Yeah. And fighting this fight together. So that's why it's important. What happens there is happening here, what's happening here is happening there, and it's happening to primarily Black people, but Black and brown people. We just got to stand in solidarity.
And they almost have no line between the Black and South Asian communities in England, for example, because they're like, we're all under the boot. We all are. But, because I'm up against the clock, we are fighting it seems like we're fighting the same fight, we're fighting for democracy, Frank, abroad, but we're fighting for it here still. I mean, I had a caller yesterday who was understandably confused about our right to vote. He said, we have the right to vote. We have the right to vote. I said, no, it ain't that simple. Please explain that, Frank Watkins. Because it seems like all of this is tied in together.
Yes, it definitely is. Actually, I wanted to comment on the racism you were talking about in the international community. Obviously, white racism and white superiority goes back a long ways. I'm not an expert in all of this, but it seemed to me that out of that racism, grew colonialism. I mean, that was the whole point of colonialism. At one level was, white people being superior to people of color and ruling over them. And they even turned the language around, if I'm not mistaken, and they referred to it not as the sympathy was not with the people who were oppressed, but with white people. It was known as the white man's burden. That he had to assume the responsibility to raise these, inferior peoples, quote unquote, to a higher level. It's true what he said about Syria and Hungarians not welcoming the Syrians when they got in trouble, but it's to some degree it's even true relative to the Ukrainians. Ari Veshi is broadcasting from Hungary, and he has been distinguishing between the welcoming arms in Poland and the more hesitant arms in Hungary. So I don't know exactly what that's all about, but there has been some differences even between Poland and Hungary relative to, the Ukrainians who are trying to leave the country. The third dimension that is interesting to me, there's a black gentleman, I've forgotten his name, but apparently he is a scholar and a journalist that has been on MSNBC quite a bit. And his angle has been to talk about how Putin talks about Ukrainians and Ukraine. He says Putin talks about Ukrainians like white people in this country talked about black people as kind of subhuman. They're not really people. And as we know, Putin does not really consider Ukraine to be a legitimate country.
Look, this is a gentleman from the Atlantic Council, right?
Correct.
Right. But let me ask you this. Has he also talked about the Azov battalion, who are Nazis and neo-Nazis who are now on the front lines of the military in Ukraine? I mean, one was honored by President Zelensky last year.
Yeah, well, he's spoken to that and indicated that there's probably less than 1% of in Ukraine who are, and he acknowledged that there have been some neo-Nazis, and that neo-Nazis has been a problem in Eastern Europe, but he's talked about it in terms of being less than 1%.
Well, the gray zone,
definitely not.
Max Blumenthal's paper says something far different, but it is an issue. It is there. Neo-Nazis and Nazis are there.
Okay. Well, again, I'm not an expert, and I'm just going off of what a person who has lived there for quite some time. Apparently, he's a scholar and a journalist as well. But
I'll send you this report because you're hearing the New York Times, and a lot of people have been saying it. Then they've been talking about the Nazis and the neo-Nazis in Ukraine and in Europe. And then, it's like you kind of push that story back. And then you see things about, when you see dark-skinned people being blocked from getting out of a place that's about to get bombed, you're like, whoa.
Yeah, I think obviously that's a negative point, clearly. And they've documented that, black people and people of color have had some problems. That's clearly the bad news. There is some good news in the sense, I remember, Mika Brzezinski, who is, co-host, married to Joe Scarborough for Morning Joe, and her brother is the ambassador to Poland. And once she saw what was happening relative to people of color, she called him, and he jumped, according to her, he jumped right on it and investigated to clear that up. On the other hand, in Ukraine, when their government heard about it, they also issued a directive, I guess, whatever, a statement indicating that everybody seeking to leave, Ukraine under these conditions should be treated equally. So there was some response, which is better than what has happened in the past. So I just, those were some of my ideas or thoughts that I had while you were talking about this situation. In terms of voting rights, because lots and lots of people vote, 158 million people voted in the 2020 campaign, and we vote for local governor and senators. Everybody thinks that because America promotes democracy and, voting and so forth, that it's just kind of assumed that we have the right to vote. But the reality is we do have a right to vote, but it's a state right. It's not a constitutional right. And in the Constitution, the 15th, the 19th, and the 26th Amendments outlaw discrimination in voting, the 15th on the basis of race, the 19th on the basis of sex, and the 26th on the basis of age. It was lowered in 1971 from 21 to 18-year-olds because of the Vietnam War. We had 18-year-olds fighting in Vietnam but couldn't vote for the policy that was sending them there. And so we passed a 26th Amendment to allow them to vote. Now, that's important, or it can be understood in terms of state, in other words, as part of states' rights. Your right to vote is part of states' rights. You have a state right to vote. And because you have a state right to vote, because states are supposed to be protecting your right to vote, because states oversee elections and so forth, it's why you can have over 400 pieces of voter suppression legislation introduced in 49 states. I'm sure you've heard people talk about that. Well, they've introduced, Republicans have introduced over 400 bills where, Republicans, they've been passed in, I think, 19 states have passed 34 new voter suppression bills. So that very emphasis makes it clear that your right to vote is a state right. What the Rainbow Push Coalition and other organizations are fighting to add a right to vote amendment to the Constitution. The ultimate irony, from my point of view, is after the Heller decision, which was a decision about guns in 2008, guns in the District of Columbia, the Supreme Court overturned, 220-year history of interpreting it as as the words of the Constitution, a well-regulated militia. They left that part out, where you generally think of a National Guard or something like that, a well-regulated. They said, no, the Constitution means every individual has an individual right to a gun. That's the meaning of the Heller decision. So the ultimate irony is that we have a fundamental individual right to a gun in the Constitution, but we do not have a fundamental individual right to vote in the Constitution. And that, in what's considered or what we promote as the world center of democracy. There are 119 nations in the world that in some manner elect their public officials in some democratic manner. 108 of them have a right to vote in their Constitution. The United States is one of 11 nations that does not have a right to vote in their Constitution. So we are partners with countries like Iraq and Azerbaijan and so forth, but for not having a right to vote in our Constitution.
Out of all the nations on earth, only 11 don't have the right to vote in the constitutions.
Well, of the 119 that elect their officials in some public manner,
Yeah.
correct. Now, what would adding a right to vote amendment change? What would it do? Well, it would give Congress the power to pass legislation that would be appropriate in every state or would be binding in every state. In other words, if you had a right to vote amendment, first of all, you would have an individual right to vote. Quite honestly, I don't I'm not a lawyer, so I don't fully understand what this means, but apparently when voting rights cases go to court, they do not involve the highest scrutiny, which is called strict scrutiny in the courtroom. So the right to vote has a less stringent criteria in the courtroom than some other issues do. So if you had a right to vote, Congress could pass legislation, let's just say, that every state must have at least 14 days of early voting. Now, some states could do more. You could have 21 days or what have you, but you couldn't do less than 14 days if Congress passed a law. If Congress passed a law saying that you must have same-day registration, that means states could not take away the ability of a state to have same-day registration. As a matter of fact, if they pass such a law, they would be required to have same-day registration. In other words, Congress could pass common sense minimum standards that would be applied throughout the entire country in terms of voting rights. They could require certain technical things relative to machines. They could require a certain number of machines per voter. As you know, right now, what they're doing is closing polling places, are reducing the number of polling places and reducing the number of machines that are in each of the polling places in communities of color. So that's why you wind up with these long lines. There's a certain criteria that Congress could pass relative to, quote unquote, cleaning up the rolls. Right now, they're in the name of cleaning up the rolls, they're taking valid and legitimate voters off of the rolls. Congress could pass a law setting the criteria that they could not violate nationally, about cleaning up voting rolls. Obviously, people die, people move, people go to other states, etc., and so there is a constant need to clean up and correct our voting rolls. But there are ways to do that are non-discriminatory, and that's what Congress could pass a law that would allow that kind of thing to happen.
Frank, will you come back and walk us through this? I mean, CK, I think I've got about 45 seconds. Having him walk us through this, I think, is so important, CK and Attorney Myra.
I agree. And I'd like us to continue to discuss it. What's going on in Ukraine, our listeners need to understand how critical it is for us to look at the conflict through a certain lens, that we don't need to always buy what we see on television. It is a completely different analysis that we're missing here in the United States.
You know what? I invite you back, Attorney Myra. I invite you back, Reverend Watkins. Everybody get the book. A More Perfect Union, Advancing New American Rights. Yes, it was out 20 years ago. This is the anniversary edition. It has been updated, and it is a fantastic book. We're going to have you all come back in a matter of days, if you don't mind. Yes.
In the updated version, we did an entire separate chapter on the right to vote and on eliminating the Electoral College, which is different than the original book that we put out in 2001.
Well, you know what, CK? We got to have him come back in a few days to talk about this, because this is the work. This is the work as we're fighting for freedom and justice in Ukraine and all over the world, and in Ethiopia and in Yemen, everywhere. We've got to fight for it here. The struggle continues, everybody, and victory is certain, but you got to fight. Attorney Jean Moore, Myra, I want to thank you for all of the work that you've been doing down through the years on all the continents. God bless you. Reverend Frank Watkins, thank you for being a leading light, and thank you, CK, for being a modern day heroine. I love you, everybody. Can't wait to be with you tomorrow on the Santita Jackson Show. You all were great. Frank, you know you have to come back. And I have to say that with hesitation, CK, because Frank does not like to do this sort of thing. But I don't care.
Everyone,
It's so great to hear you again and to share a panel with you.
everyone's off except for Attorney Hoffler.
I didn't get you here in Buffalo, but this is a great show. Thank you so much.
No, thank you. And so, you know what? Let's extend this conversation with Attorney Myra.
Okay, she's calling me on the other line. So
Okay.
I will let her know.
So please do that. Let me know when we can do that, because I think that we should. Okay?
Okay.
Sending you much love, girl. Thank you. My love to your friends, okay? God bless. Bye-bye. I love you, everybody. See you tomorrow on the Santita Jackson Show. Bye-bye.